Which FSH test is best for menopause, blood or urine? Imagine trying to figure out if your body is saying goodbye to your reproductive years. One way doctors do this is by checking a hormone called follicle-stimulating hormone. But which test gives the clearest picture? Blood or urine? Let's explore how each one works and which is better for understanding menopause. When it comes to measuring follicle-stimulating hormone levels, blood tests are the most common choice. They involve drawing a small amount of blood from a vein, usually from your arm. These tests are considered more reliable because they give a direct measurement of the hormone at a specific moment. That's important because follicle-stimulating hormone levels can change throughout the day and during different parts of your menstrual cycle. So, a single blood test might not tell the whole story. Doctors often look at your symptoms, menstrual history, and sometimes repeat the test over time to get a clearer picture of whether you are in menopause. Urine tests, including those you can do at home, measure follicle-stimulating hormone in your urine. They are more convenient because you can do them yourself without visiting a clinic. These tests work by collecting your first urine of the day, which contains accumulated hormones. They can show if your follicle-stimulating hormone levels are high, which often happens during menopause. However, urine tests are less precise because they reflected hormone levels over a longer period rather than at a single moment. Factors like hydration, recent use of birth control, or hormone therapy can influence the results. While urine tests can detect elevated follicle-stimulating hormone about 90% of the time, they are not enough on their own to diagnose menopause or perimenopause. For accurate assessment and medical guidance, blood tests are generally preferred. They provide a clear, direct measurement that helps doctors interpret your hormonal status more accurately. Urine tests can be helpful for initial screening or for convenience, but they should not replace a full medical evaluation. Because follicle-stimulating hormone levels can fluctuate during the transition to menopause, healthcare providers often consider multiple factors beyond just the test results. In summary, blood follicle-stimulating hormone tests are more reliable and useful for diagnosing menopause. Urine tests, including home kits, are easier and more convenient but have limitations in accuracy. For a complete understanding of your menopausal status and personalized care, talking with your healthcare provider is always the best step.